false reassurance when something serious is actually brewing.
So you've got this system under immense pressure, financial pressure, administrative pressure.
Potentially compromising care. And if a doctor tries to speak up about it, tries to blow the whistle on negligence or bad practices.
The consequences are brutal.
Devastatingly so. The sources talk about what happened to doctors, particularly within the NHS, for example, who tried to report wrongdoing. Chronic stress, anxiety, depression, even suicide.
How does the system retaliate?
Tarnished reputations through biased reviews, being sidelined, isolated professionally, basically ostracized. The system protects itself, protects its reputation, often at the expense of patient safety and the ethical doctors trying to uphold it.
It's a grim picture.
Yeah.
And it creates this vacuum almost.
Precisely. A vacuum where the established system seems unable to fully contain the problem, especially something like antibiotic misuse and infectious spread.
And that's where Dr. Maya comes in. Not designed by administrators worried about budgets, but driven by this urgent need to prevent catastrophe.
Exactly. Its stated goal is explicit: to prevent delays and reduces the risk of epidemics and pandemics. It's framed almost as a survival tool born out of systemic failure.
Okay, so let's get into the nuts and bolts of it. How does Dr. Maya actually do this, the color-coded approach?
Right. The whole mission is about empowering people, giving you more control over your health decisions, protecting you and your family from, say, unnecessary antibiotics, and hopefully reducing complications or hospital visits.
And it does this by simplifying things drastically with colors.
Yeah, it bypasses that whole complex narrative we talked about earlier, at least initially. It relies on standardized symptoms or signs that you input, and then it assigns a color code. It's rapid triage.
So what are the codes? Green, yellow, red.
That's it. Simple as traffic lights.
Okay, break it down. Green means?
Green generally means minor symptoms. Things you can probably manage yourself with self-care, maybe over-the-counter stuff from a chemist, or perhaps just monitoring. Low risk.
Yellow.
Yellow suggests moderate severity. This is where you probably need to see a professional, your GP, a nurse prescriber. They might need to do a proper clinical exam, maybe run some tests to rule out anything serious. Needs assessment.
And red.
Red is the alarm bell. Severe or complex symptoms. This means immediate action required. Go to A&E, the emergency room, or call for urgent medical help. High risk, potential emergency.
So it's basically risk stratification, instantly tells you how worried you should be.
Exactly. And from a public health view, this is huge. If the system flags something potentially infectious, even in the yellow zone, it can advise on isolation early. Stay home, don't spread it to family, friends, colleagues. That immediate safety step is something the AI can prompt without needing a full consultation first.
And this is where the AI has an edge, maybe. It's not bound by the same rules or pressures as a human doctor.
That's the argument. A human doctor might be juggling multiple patients, constrained by time, maybe thinking about costs or protocols. The AI's prime directive here is safety and preventing delay. Delay can be catastrophic with infections or serious conditions, so it defaults to the safest path.
It's mimicking that ideal clinical decision flow we talked about.
Kind of, yeah. Remember how a good doctor faced with serious symptoms immediately refers to hospital? If symptoms are moderate, they investigate further. If mild, they advise home care. Dr. Maya's colors aim to replicate that logic flow, but instantly and consistently. Its mission is explicitly safety, to prevent and protect patients and healthcare workers, and to prevent complications, hospitalization, and even death.
And this seems crucial. It's not actually diagnosing you in the full sense, is it? It's a guide.
Absolutely critical point. The warning is clear. Self-diagnosis, even with a tool like this, should never replace professional medical advice. Dr. Maya is designed as a first step. It helps you understand potential severity and tells you who to see: chemist, nurse, doctor, hospital.
Because uninformed self-diagnosis is dangerous.
Hugely. You can be inaccurate, misinterpret what you're feeling, get false reassurance, and delay seeing someone when you really need to, or completely miss a serious underlying condition. Dr. Maya tries to mitigate that by being structured, forcing you to consider specific red flags.
Okay, let's make this concrete. How does it handle common symptoms? Fever, for instance. Everyone gets fevers.
Right, but what kind of fever matters? A mild or moderate fever might keep you in the green or yellow zone, to be the bacteria needs a checkup maybe, but a very high fever. That could be viral, sure, but it could also be linked to something serious, like a head injury. That pushes towards yellow or red. And the real red flag, chills and rigors. That shaking, feeling freezing, then burning.
Yeah, that's unmistakable when it happens.
Unmistakable and serious. That's an immediate red flag. The system would push for urgent assessment for things like sepsis or malaria. It forces that escalation.
Okay. What about something like abdominal pain? That seems notoriously tricky.
Very tricky. And prone to what the source calls lazy diagnoses. You go in with stomach pain, maybe some loose stools. It's easy for a busy doctor to just say gastroenteritis, stomach flu.
Right. Drink fluids, rest up.
But what if it's appendicitis or a perforated ulcer? Those need surgery, fast. Missing them is dangerous.
So how does Dr. Maya try to prevent that shortcut?
It forces you to check for other things. Is there a fever too? Any blood or mucus in the stool? Have you lost your appetite completely? Anorexia? Any pain when you pee? Dysuria? If the pain is sharp, constant, and lasts more than, say, 2 hours, the system won't let you stay in green. It'll escalate you towards yellow or red, pushing for that second opinion, that proper check.
It's adding that layer of systematic checking that maybe gets skipped sometimes?
That's the goal. Same for respiratory symptoms. You might have a recurrent cough, maybe breathe through your mouth, snore a lot, often linked to postnasal drip. Easy to just call it a common cold.
But it could be something else causing the drip. Allergies, chronic infection.
Exactly. The system pushes you to look beyond the simple label. Are there other symptoms? Chest pain, shortness of breath, dyspnea. Those are red flags. They'd immediately shift the color code, demanding a proper medical evaluation to find the underlying cause, not just treat the cough. It's about forcing a safe action, not just settling for an easy label.
Okay, so the system aims for safety through simplification and forcing checks. But this brings us squarely into the AI paradox, doesn't it? The promise versus the peril. We see the human system's flaws, but AI isn't perfect either. It has its own failure modes.
Absolutely. And this is where it gets really complex. On one side, AI has shown incredible power. Studies confirm it, especially in image analysis, radiology scans, dermatology photos, eye scans.
Right, it can spot patterns humans might miss.
Yeah, its diagnostic accuracy in those areas can be as good as or even better than less experienced doctors, sometimes hitting accuracy rates up to 90%. In many measurable ways, AI can perform better than standard care management.
But there's always a but with AI, it seems. Relying on these algorithms for critical triage, what are the big vulnerabilities? Algorithmic bias seems like a huge one.
It's arguably the biggest open challenge right now. AI learns from data, massive amounts of data. But what if that data isn't representative of everyone?
Like if it's trained mostly on data from one demographic group.
Exactly. Say, if the image data used to train a dermatology, AI mostly features lighter skin tones. That AI might be great at spotting melanoma on light skin, but terrible at spotting it on darker skin because it hasn't seen enough examples. It ends up reinforcing existing health inequities. Making sure the AI works fairly and safely for everyone is paramount. If it doesn't, it fails ethically.
So there's passive bias from the data, but then there's active manipulation. Adversarial attacks, you mean people could intentionally try to fool the AI?
Yes, and it's surprisingly feasible. These aren't like hacking in the traditional sense. They're subtle changes to the input data designed to trick the algorithm.
Like what?
For images, simply rotating a picture by a specific calculated angle could potentially change the AI's diagnosis. For text-based systems, swapping certain words for carefully chosen synonyms might confuse it into making the wrong assessment. These changes might be invisible or seem irrelevant to a human looking at it.
That's worrying. And the sources mention this could even be used for financial gain, like manipulating insurance claims.
Yeah, that's a really concerning possibility. Insurance billing relies on specific diagnosis codes. An attacker could potentially use these adversarial techniques to figure out which subtle changes in describing symptoms or which synonyms might trick the AI into assigning a diagnosis code that pays out more money from the insurance company.
So automating fraud, essentially.
Potentially, yes.
Yeah.
It shifts the risk from just diagnostic error to actual intentional financial manipulation. It underscores how critical security and robustness are for these systems.
Okay, so even if the tech itself is perfect, which it isn't, there are human barriers. People might just not trust an AI with their health. Why the resistance?
Research points to a few key psychological factors. First, pretty simply, the need for personal contact and peace. People just value talking to a human. They want empathy, judgment, that connection.
Makes sense. What else?
Second, perceived technological dependence, PTD. This is the feeling of becoming too reliant on the technology. People worry about losing control, or maybe that the infallible machine will somehow dehumanize the whole process of care.
A fear of being reduced to data points.
Sort of, yeah. And third, there's just general skepticism toward AI, GSAI. Let's face it, AI is often hyped up, marketed as revolutionary. People are naturally cautious about new tech, especially when it involves something as personal and high stakes as their health. They might prefer the methods they know, the tried and true human doctor.
And then there's the whole regulatory side. Can the rules keep up with how fast this tech is changing?
That's another major hurdle. AI, especially the kind that keeps learning and updating itself after it's released, needs constant monitoring. A total product lifecycle approach, they call it. Regulators are struggling to build the capacity to oversee this properly. The tech evolves faster than the oversight mechanisms, which doesn't exactly build trust or ensure safety across the board.
So it feels like we're caught in this difficult place. We've got the human touch, the narrative, the deep listening, which is vital but maybe slow and inconsistent under pressure.
Right. And then we have the algorithmic approach, like Dr. Maya, offering speed, consistency. That safety-first mandate needed to tackle huge threats like AMR or pandemic spread, but it comes with its own risk bias, manipulation, trust issues.
So the path forward has to be about bridging that gap somehow.
It seems that way. The real value probably lies in finding the right balance. We need the efficiency and the structured safety checks that AI can offer, especially for rapid triage. But we can't lose the human element, the empathy, the moral judgment, the ability to see the whole person behind the symptoms. AI can't replicate that holistic understanding.
Let's circle back to the name Maya one last time. That idea of contradiction, the mist over reality.
Yeah, the philosophical Maya is about recognizing life's inherent paradoxes. The practical Dr. Maya, with its color codes, seems like an attempt to cut through that, to define simple, actionable facts, green, yellow, red, within all the complexity and uncertainty of illness and overloaded systems.
It's like it's trying to force clarity in the fog.
Exactly. Forcing a clear, safe action. Seek care now. Isolate, wait, and see, rather than letting us get lost in the mist of maybe, perhaps, what if. It pushes responsibility onto the user to act based on that simplified signal.
It's using a simplified map for a very complicated territory, acknowledging that sometimes, maybe, the immediate safety signal is more important than getting the perfect, nuanced understanding right away.
Which leads us to our final thought, something for you, the listener, to mull over after this deep dive. We all want the truth about our health, right? The objective reality. But how much of our journey towards health is actually shaped, maybe necessarily shaped, by things that give us a sense of safety, even if they're simplifications? Whether it's the doctor's reassuring story, a rigid protocol, or even a simple color-coded sign from an app.
Where do you place your trust when navigating that uncertainty, especially when the stakes feel incredibly high? A question with no easy answer. Welcome back to the Deep Dive.